been expecting you today. It's a pleasure to meet you. I'm Madame Murmuring. Lovely to make your acquaintance. I am Dr. Pennyworth's student. So he is rather busy, as you know, these days. And for milder cases, I normally tend to, prior to referring to the great Dr. Pennyworth, rest be assured that I have studied for a long time with him, and I will make sure that you are properly assessed. Alright? Now, I believe our reception made some notes. Well, that's what you like to call it, reception lady. She's not particularly busy, let's say. Aha. So, you've banged your head at the theatre. What were you watching? Oh, I've always wanted to see Lady Windermere's Fan. I've heard that it is a fantastic play. Well, we ought to take a look at your head, so... Okay, so you had some dizzy spells. Okay. Well, we'll assess that today. I think I'll perform an exam that was shown to me by the great Dr. Pennyworth. It's all to do with your nerves. You have special nerves that run all the way from the top of your head all the way down your spine. That's right. And it ought to potentially be that maybe you have damaged one of these nerves. And if that's the case, then we ought to send you to the apothecary for some medicine for that. But we need to assess first if that truly is the case. So I have a number of assessments that I'm going to do today. You'll be very relaxed here, don't you worry. I'll take great care of you. But first, tea. I don't want it getting cold. It's the only thing our reception lady can do correct. It's a cup of tea. Alright. Now, obviously we're using this light. You're not afraid of flames, are you? Because I'll need to use this rather close to your eyes. So I wanted to just make sure. Okay. So, let me have a look first. We're going to assess your scent. That's right. And I have a number of different things for you to smell that you ought to know what the smell is. Okay. We'll start with the first. Did you know that Dr. Pennyworth is currently in theatre at the moment with the Button Thief? Did you not hear? The Button Thief, or so they're calling him, came in with stomach pains, and in his stomach was an entire selection of different buttons. So, Dr. Pennyworth is having to sort him out. Get rid of all those buttons that were not passing. Okay. Now, close your eyes, and I'm just going to wave this across. Okay. Let me know when you think you can smell. This is indeed a lemon. Okay, well done. But yes, it's been awfully interesting today with the buttons leaf indoors. We don't get such fascinating subjects here. Usually it's the mild concussion like yourself. Okay, just going to wave this across your nose. How does that smell? Yes, this is indeed a rose. It's very poignant, so I'm pleased that you were able to smell. The next one. Just running this across your nose, like so. It is indeed jasmine, well done. I do love a jasmine tea. Okay, number 4. I do wish one day that Dr. Pennyworth would allow me into the theatre with him, but he believes that it is not a sight for ladies like myself. I beg to differ. I think I could handle it. Maybe one day I'll hide and watch from afar and he won't know. Oh, I may have to keep pestering him. Okay, number 4. Do tell me what this smells like. It is indeed marigold. Correct. You are doing very well, I have to say. And the final one. It's a little bit messier. Just going to wave this in front of your nose. Lavender is correct. Well, full points to you. I don't think there's anything wrong with your nose at all. Not one bit. Alright, now we're going to move on to your eyes. And there's quite a lot of testing to do with your eyes, I'm afraid. So, I'm going to take a close inspection of them to begin with. So please just look straight at me. Okay. Look up. Look down. To the side. And the other side. Up again. And down. This side and the other side. Okay. Please focus on this. I'm going to bring it out, and then I'm going to bring the light all the way back in and out again and all the way back in. So far, so good, I must say. please just follow my finger. Okay, I'm going to bring it from here, in, and out. Just focus both eyes on the finger. Back out. In, and out. And in, and out. Okay. Now, I do have a chart that I would like you to read from. It is a little faint, I have to say. I'm in need of a new one, but it was only written a week ago. Can you tell me what any of the letters are on the top line? How about this line here? Any of this line? This line? And the bottom line. Not to worry, it is a little bit faint. You may see closer up. Yes, see, it's rather faint. Okay, that will do, that's fine. Okay, now we need to look at the periphery of your eyes. So we're going to cover this one, and I want you to tell me when you can see my finger come into your vision. Okay, so cover this. Okay. Well done. And this eye. Well done. Good job. Very good job. You're doing awfully well. It's looking like your eyes are doing well. Do tell me, what colour is my dress? Okay, that is fine. I just wanted to check your colour very quickly. So, I think getting the colour of my dress is fine, and I'm sure you would notice if you were struggling with your colours. Indeed, I agree. Right, moving on. Okay, so we are going to do some light and harsher touches to test all of your senses, let's say, in your face. Okay, so my little tray. I'm going to start with a little gauze. Okay. And you're going to let me know when you can feel a very light touch. Okay? Great. So, I managed to acquire the tray from the tooth doctor next door. What a fellow he is. Pretty awful if you don't ask me. He only sees the most fortunate ladies and gentlemen in the town, those who can pay his unprecedented prices. Although I'm not sure how much more he can offer than the twigs and cloths that we all use for our teeth. However, he is offering this new tooth powder. Apparently, it stops the decay. So noises. But I have heard stories from some of the maids. Yes, some of the maids have reported that their masters and mistresses have been hallucinating once they're taking the tooth powder and saying awfully jolly things that should not be repeated. So I'm very intrigued in what is in this tooth powder. I ought to try it for myself, if only I could afford the prices. But perhaps Dr. Pennyworth will acquire some for us all to try. It would be a very entertaining evening. Jolly with tooth powder. Very good. Very, very good. There we are. Now, don't be alarmed, but I'm going to now give you a very gentle prick with this. It's very gentle, you'll not feel it. Well, you ought to feel it, but you will feel not quite pain, maybe a little bit of a shock. It is not going to pierce the skin. It's gentle, but it's a little prick. Okay. So again, just let me know when you can hear. When you can hear, when you can feel. It's like as if I've had some of that tooth powder now, mixing up my words like that. Very good. Very good. Yes, the tooth doctor next door is rather grumpy. I don't know why. Apparently he has many a mistress. Especially he likes to be seen at the burlesque club. And some interesting evening dinner parties in the gentlemen's only chambers. So I've been told. But he's got an awfully stern look upon his face at times. I do say good morning, and he often ignores. But I guess I can keep trying. Okay, I think I'm satisfied that you have feeling in your face. It wasn't so bad after all, was it? I didn't think so. Right, okay. So we're just going to have a quick look at the movement of your jaw. Can you please open wide for me? Just going to. Okay, and let me just gently move this from side to side. That's it. I apologise if it's a little bit uncomfortable, but I need to see. Can you close your mouth? Can you pretend like you're chewing? That all looks good. I'm looking for any sort of strange behaviour of your mouth. Sometimes people with this injury that I'm looking for can have their jaw hanging to the side, you know, and they may not be able to chew, but it looks like you can, and you can speak, so I'm not awfully worried. Okay, so we're now going to move on to your hearing. Now, I have to admit, I did have my metronome I was going to use today. However, my metronome is not working how it should. My metronome is not working as it should. And I'm afraid if I use it, I may misdiagnose your hearing. So, instead, I'm going to do some gentle whispers in one ear, and I'm going to distract you with your other ear. And you have to tell me what I said. Okay? The stars. Magic chef. you did awfully well for all of them. Perhaps I was whispering too loudly, but they were very good, so well done. I don't think there's much wrong with your hearing. Alright. Okay, so we're going to look at your facial movement. So I'm going to ask you to do a number of different expressions so I can assess whether all of your normal emotions and facial movement are working correctly. Alright? Okay. So please, raise your eyebrows as high as they will go to the heavens if you must. Wonderful. They are awfully high. Okay, you can bring them down back to earth. And can you please scrunch your eyes so tight as if you're trying your best not to look at what's in front of you. That's it. Nice and tight. Okay, I think all of the movements are okay. I'm actually going to bring this a little bit so I can see the light on your face. Okay. Now, can you please blow out your cheeks? So you go. You may look like a silly fool, but it's for a good purpose, so blow out your cheeks for me, please. Excellent. Very good. Now can you give me the biggest smile you ever gave anyone? Amazing. Very good. And can you purse your lips so like this? It's a good purse. Very good. Okay. I'm pleased with how that's looking at the moment. Okay. So I'm going to just move on to a little bit of movement now, if you don't mind. I thought I ought to ask, do you live in the town? I feel like I've not seen you before. Oh, on the west side. Over the bank. Okay. Now I know who you are. I've seen many people here in Dr. Pennyworth's office, but I thought I've not quite seen you. I thought you'd ask. And what do you do, may I ask? Ah, I see. And did you have to leave the theatre early? You want to go back and see that then, I imagine. Okay, so quick fire questions. I am a little bit nosy at times, you know. Okay, so I would like you to turn your head like this. Okay, now I'm going to put my hand here and I want you to turn into it. You're going to feel some pushback, some resistance. And I want you to just keep pushing against my hand, okay? That's it. Keep pushing. There we are. Well done. Okay. And the other side as well. I'm just going to put my hand there. Just keep pushing. Very good. Alright, now I'm going to put my hands on your shoulders like so, and I want you to try and shrug your shoulders. Okay, so just shrug them normally just now so I can see the movement. Okay, very good. Now if I put my hands on again, the same as the head direction, I want you to just push against my hands. Okay. There we are. Wonderful, you've got some strength there. Indeed, indeed. Okay, so we're almost finished with your exam. So far I've not seen anything to be concerned about, so you to stick out your tongue nice and wide. Say ah. Stick out your tongue. That's it. Okay, and can you move it side to side? Alright. You can stick your tongue back in again. Well, I ought to say that I don't think that you have done any damage whatsoever to your cranial nerves. No, but you did report a headache. I hate when those happen. I think a headache is too minor for Dr. Pennyworth to inspect, and you wouldn't like him to inspect your head, I imagine. No, I don't think anyone would like that. They say the pain medication's not quite so great, you know. Hopefully moving into the next century we'll be able to have some better pain medication so that you don't feel it. Poor fellows that are in that theatre. I'm just thinking of the poor, well, I don't know if I should say poor, but the button thief in the theatre at the minute. Hopefully it worked for him, but then he shouldn't have eaten so many buttons. I wonder if he thought they tasted nice. Perhaps he thought they tasted of a roast turkey dinner. Perhaps some bread. Oh, some custard. Milk even. Yes, maybe some potatoes. Potato and leek. That could be interesting. I still don't think they would chew, surely. Be awfully hard on his teeth. Maybe he'll need to go and see the teeth doctor next. I imagine his teeth ought to all be broken. So, sorry, my apologies for rambling off there. So, with regards to your headache, I think it would be best to go and see the apothecary, because in the apothecary they can make up some incredible different types of little elixirs with little things in them that you wouldn't think would work together, and they do. And they can fix a headache, although it may make you sleepy and hallucinate a little bit. Depends what they give you. But something like that ought to shift the headache. But do make sure that you keep aware of this dizziness, because if the dizziness continues, then you may have to come back and see us. You may have to come back and see Dr. Pennyworth. But I don't see anything wrong with you. I don't think you're overly hot either. No. So you're not burning up. You've not got fever-like feelings. You just have a sore. Do you know, I do see here. Is that sore? I think you have a sore head because this part of your head, where you've hit, it's a little lump. Slightly raised there. It's not so good. But it's tender, you know. That will go down. What you should do before you go to the apothecary is, if you get some cloths like these, dip them in some cold water, and hold it to that area. That will take some of that lump down, and it may start feeling better. I think that's what you ought to do. Yes. Well, I dare say it's been a pleasure to have you here. It's probably not been for you, but for me it certainly has. Please do not tell anyone that it was me that told you about the button thief in the theatre. We must keep that. Shh, hush hush. Along with the tooth powder. It is town gossip, but don't let anyone know that you got it from me. If I do try it, I'll let you know if I see you about in the markets. Well, have a good day, and hopefully we do to see each other soon. Take care of yourself.